Hey everybody, good morning or good afternoon, depending on where you are. My name is Dave Servadidio. I'll show you a picture of my face in a minute, but we're super excited to kick off today's webinar. Today's session is how to effectively manage vendor enrollment and compliance in 2019. Just super excited about it. This is a topic that, as you guys know from being on this call, we do webinars on a monthly basis. And we try to source feedback after every one, just how you like it, how you don't, things that you would change, or some topics you might want to hear in the future. And this is one that came up a couple months in a row. Just how can we start a conversation about vendors, about just how to monitor them, how to look at enrollment differently in 2019. What are the regulations and requirements, and how do I ensure compliance just for my organization as we go and finish up business planning? So excited for today's session. Really appreciate you joining on the call. A couple things before we get rolling. We would love to answer any questions, and we'll do it. We'll stop and pause a couple times throughout the session, but at any time, if you have a question, or just want to know something or want to dig deeper into a topic, go ahead and type a question into the panel that you see on your screen. We do address all these. If we don't make it to address your question on the call, sometimes we get a lot. We will follow up with you and make sure you get everything answered. So please feel free. This doesn't have to be us just talking at you for 45 minutes or so. We are more than happy to answer any questions on the fly. The last thing before we jump into today is we are offering CEUs for today's session. So for everybody that joins live, which is all of you listening to my voice, you guys will receive your CEU credits. That will be coming to you first thing tomorrow morning. So you will receive that. Please be on the lookout for an email with those credits from us. Again, it's free. You don't have to do anything. You just get them for being on the call. So thanks again for your time. Again, I promised you I'd show you a picture of my face. There I am on the left. My name is Dave Servadidio. I lead our marketing efforts here at Provider Trust. And I am joined by the lovely Donna Thiel, who is our Chief Compliance Officer and heads up our thought leadership here at our organization. You'll recognize probably her definitely from past webinars, and maybe me. I jump in from time to time. A little bit about who we are and kind of what we do. On the next slide, we like to say we're made with love in Nashville, Tennessee. What we love to do, and we've been doing it for years now, is just delivering compliant solution insights from America's healthcare capital on a monthly basis through these webinars. We started doing these years ago and have always done them on a monthly basis, and they've always been free. So we love that our audience continues to grow, and please just continue to let us know what we can talk about to continue to stay relevant to you and help your job. In a nutshell, what we do is pretty simple. We are focused on ongoing healthcare license, certification, sanction, and exclusion monitoring. We do all things people and entities. That is a daily and ongoing monitoring process. We're a SaaS company. We're based in Nashville. Our software as a service is flexible and adaptive to unique needs. We deliver real-time accessible data 24/7 via secure accounts, and we're committed to providing what we would say is freedom from process so you can focus on people. Really what that means in a nutshell is we touch this stuff every day, which is why a lot of the insights and case studies you'll see from us in today's presentation are real life examples of things that we've seen for some of our clients. It's the reality of what's going on in the industry, and we do our best to deliver it back to our partners because we see it on a daily basis, but we realize that not everybody spends as much time as we do in the data. So anything that we can provide is a value add from us to you. Quick agenda for today. Donna, do you want to take them through the agenda?
You bet. And maybe just one quick reminder, in addition to the CEUs that'll come out tomorrow, this PowerPoint presentation will also come to you. So you don't have to worry about taking copious notes. Matt will be in charge of sending you out an email tomorrow that'll have your CEUs and a recording of this, a link right to the recording, yes, and the PowerPoint presentation. So quick little note. So yes, so today what we're going to talk about is we're going to start with compliance and exclusion 101. Probably a little bit of information that you already know, but always good to make sure we have a level set. Then we're going to talk about explicitly vendors, owners, and downstream providers. What is that? What do they look like? And we're going to show or share a couple of case studies related to vendor exclusions. We don't talk a lot about that, so we thought we would highlight a few of those for you today. And then we're going to end with what an effective enrollment process looks like. So how do you start thinking about your vendor management and exclusion monitoring as you're preparing for 2019? So let's get started. We're going to start today, as we do very often, with a polling question so that we make sure that you all can see the screen, that you have an opportunity to share your thoughts with us. So the first question is, how often do you currently monitor your vendors for exclusions? The question should be on your screen. So there's 4 options. We're not currently monitoring our vendors. At time of contracting only, so like right away, right when you're initially having that relationship with your vendor, we do it once a year, or we're doing it ongoing, or maybe perhaps explicitly on a monthly basis. So let's go ahead and we'll give you another second or two to share your thoughts, and then Matt will close out the polling question. All right, let's see what our answers are. So right now, 11% of everyone on the call is not monitoring our vendors. Some of you are just doing it at time of contracting. About 10%, a tenth of everyone is doing it annually. And then 65% are doing it on an ongoing or monthly monitoring basis. So that is fantastic news. So a third of our folks may have some opportunities to increase the monitoring. And maybe by the end of this call, we'll kind of talk about why we think that might be important. All right, let's go on. So our next slide is what is an exclusion, right? So when we talk about it, we probably all understand this, but an exclusion is an administrative action, right? So it's something that the OIG or the state Medicaid agency is taking against an individual or an entity. So it's always important to remember it's not just the person, right, that can be excluded, but any of our vendor partner or organizations, entities can be excluded as well. We know that the OIG says that we cannot, as a healthcare provider, we can't contract or hire any person or contract with any entity that is excluded or sanctioned. So we can't pay any monies to a vendor who's been excluded. So it's really important that we don't get hung up. In my mind, sometimes we think about contracts, it's only contracted vendors, but it's really not just contracts, right? We may pay vendors that we don't actually have a written, agreement or contract with, but they provide a service where that contract isn't needed. So if we're paying any Medicare or Medicaid monies to an excluded person or a vendor, we as a healthcare provider obviously will be in a lot of trouble. So important to keep that in mind. The third bullet really talks about the concept of being excluded in one state, all states. So that comes from the Affordable Care Act, and we know that when the state excludes a person or an entity, they have an obligation to report that exclusion to the OIG. So it gets a little fuzzy, but at the end of the day, we have to be monitoring and looking at the OIG, the SAM, and all of the states to make sure that no one is excluded in any of those entities. And as we said before, right, you can be excluded by the OIG or by the Medicaid agency. So the next slide is just a simple slide that reminds us how many different exclusion sources there are. We all know about the OIG, hopefully we all know about SAM, but then you might not know that there are 42 state Medicaid exclusion lists. You might be saying, well, there's 50 states, why aren't there 50 exclusion lists? Some states don't publish their exclusion list. So today, there are 42 states that you can acquire exclusion lists. They're in all different size and shape. Some of them are similar to the OIG, like Texas, for example, has a list where you can go in and you can key in some information, it feeds it back to you. Other states just have PDF files that you have to download and manually kind of search through. So all the states are different. They update at different frequencies. Some do it, monthly. Some do it on an infrequent basis every 6, 8, 12 weeks. Who knows when they're going to update their list. But always remember there are 44 sources that we should be looking at. The next slide talks about where does this exclusion process start? What is this all about? So Oftentimes, where we see an exclusion process beginning is at the state level. The Medicaid Fraud and Control Unit, we call those the MFUCUs, will be potentially doing some sort of an investigation, and they might make a determination that someone's going to be excluded at the state level, which then that, of course, as we just said, would raise itself up to the OIG level, where the OIG then would have their either permissive requirement or opportunity to determine whether or not that is needs to be an OIG exclusion or if it's a mandatory reason. Another area where we often see the exclusion process starting is with a licensure issue. We're going to show you a slide in a little bit where we talk about the volume of all of the exclusions that actually are licensure related. So oftentimes you'll see a licensure action starting at the state board level where someone has a bad actor has a drug issues, been convicted of certain crimes that then lead to a board action that ultimately leads to an exclusion. Another example is a misdemeanor action related in a healthcare space or a felony. Both of those would result in exclusions by the OIG. And then the last one that we always want to highlight is defaulting on a student loan. We forget about that often. And many times when we're working with our clients and we report an OIG exclusion that relates to a student loan, they had no idea that there was even an exclusion type related to that. So just another area where you might see an exclusion. One thing you might note about the student loan, when you see exclusions, most of them are 5 years, 10 years, 15 years. A student loan exclusion can actually be resolved at the point in which the loan is repaid. So that's a much easier one for most people to resolve.
Yeah, thanks, Donna. I wanted to jump in real fast. Again, we do have a question come in. We've got several coming in, but one just was particularly relevant for this slide. This is from Astara, and she's asking, is it recommended that we check all states for potentially excluded persons or organizations? I thought that was really interesting. So Donna, do you want to answer that?
Yeah, that's a great question. I certainly would say that the easy answer is yes. And one of the reasons that we talk about how important it is because if you think about bad behavior, or if you think about someone who's perhaps has an exclusion or has maybe a licensure action that's underway, it might be in one particular state. And while that action is being taken against the license, I might quickly move to another state before the state board finishes the investigation. So I might get a license in another state while the previous state. So for example, I live in Wisconsin. So if I have a board action in Wisconsin, I'm going to quick go to Minnesota where there's reciprocity and I get my license quickly. And now I'm in good standings in Minnesota. And then 6 months later, Wisconsin revokes my license and then recommends an exclusion. And if I'm not looking at Wisconsin, I might not even know that something had happened in the previous state. So it's really difficult to look at all the states because, again, their lists are so variable, but definitely something that you want to consider looking at is all, I was going to say 50 states, but 42 states. Mm-hmm. Great question. All right, should we move on to the next slide? Yeah. All right, so in this next slide, we just talked a little bit about the penalties. As you can imagine, right, if you have paid monies to an excluded party using Medicare or Medicaid monies, it could be a false claim. So at that point, all of the rules surrounding false claims come into play, right? Treble damages, per claim potential penalties, possible exclusion yourself, all of those big things happen. But the other thing to remember is if you self-disclose to the OIG, these penalties, instead of having treble damages, you would have what the OIG commits to is really a penalty of 1.5 or a multiplier of 1.5. So these are all the really scary penalties that kind of relate to false claims. But keep in mind, if you self-identify that you have either hired an excluded person or you're contracting or you're paying a vendor, you have the opportunity to self-disclose to the OIG and control these penalties. We know there's still going to be penalties, and unfortunately, as you're going to see in some of our case studies at the end, these are significant dollars that we face if we have any relationship with an excluded party. So let's go on to the next slide. So this slide kind of pulls it all together. So this is what we call the state of an exclusion. And we use this slide a lot, so you may have seen this in previous presentations, but I love this slide. So this just helps us understand all these different sources. So if you start at the top, right now there's roughly 70,000 OIG exclusions. There's also about 70,000 healthcare related exclusions in SAM. SAM contains other types of exclusions that don't specifically relate to healthcare. So SAM has more than 70,000 exclusions in their database, but 70,000 healthcare related ones. And then the states, remember those 42 states, they also have about 70,000. So give or take, there's almost 205,000 total healthcare exclusions when you're looking at all those sources. But let's talk a little bit more about what that means. So you might remember in a previous slide, I talked about the license revocations and how important it is to monitor the licensing process. As you'll see from that first bullet towards the bottom, 43% of all of the OIG exclusions are related to license revocations. So that is the largest proportion of any of the OIG exclusions. So if you think about how you're managing your profiles within your organizations, the licensure information is really important. As we mentioned before, any of the state exclusions, the states are required to report those exclusions to the OIG within 30 days. Unfortunately, as the next bullet shares with us, the actual today, right now, the average length of time it takes for a state exclusion to appear at the OIG level is 173 days. So if you go back to the question that was just asked about whether you should monitor the various states, I think this is another good reason as to why it's so important to be monitoring at the state level, right? So 173 days is roughly 6 months. And now remember, that's average. So that means that there are some that are significantly greater than 6 months. And we can tell you from monitoring the data within our databases, we know that there are exclusions within the state that have never made it to the OIG, and the clock is just continuing to tick. So really important to kind of be aware of all those different sources. That big red number in the pie chart, the $126,000, that's the average penalty for a self-disclosure of an exclusion with the OIG for the first 5 months of 2018.
Yeah, and Donna, just to add a little bit of color too, and Astara, to your question specifically, it can be easy to look at this slide and say, oh, there's roughly 70,000 exclusions across 3 sources. They're probably the same exclusions. I think it's an important add here is that currently in 2018, about 56% of state exclusions actually never make it to a federal source, either the OIG or SAM. So when you look at that 67,459 state exclusions across those 42 sources, 56% of that 67,000 has not made it to the OIG or SAM. So if you don't have a comprehensive strategy for looking at your vendor population across all 42 states and really making sure you have tabs on the other 8 states, so if they have a list or start excluding entities, that you have a way to track it. If you don't have that holistic coverage across all of this, just across the country, you are definitely missing things because they are not reporting up to the federal sources, certainly in a timely manner, but about almost 60% of the time, not at all.
Excellent point. All right, so another polling question, make sure that everybody's still engaged and participating here. How often do you collect ownership information from your vendors? A little bit different question today. So it should be on your screen now. Opportunity for your answers are not currently collecting ownership information. We collect it at the time of contracting. We do it once a year, or we do it ongoing or monthly. We kind of do a follow-up check-in on our owners.
And there's a really interesting reason why we ask this. We're starting to see this becoming a trend of monitoring not just owners, but also looking at, not just vendors, but also looking at the owners or even managers of those vendors as well. So there is a reason why we're asking this, and we'll show you some data to support it coming up.
All right, Matt. So it looks like, and then the option of I'm not sure. So it looks like about half of us aren't really quite sure what we're doing with that. I would say that that's a really expected answer. 14% that we're not collecting the information. We do about a quarter, 25% of the time, give or take. We do it initially, and then we look at it once a year. So that's some really great insight. And I think for those of you who aren't sure, I would tell you that that is not surprising at all. I mean, that's just something that I think is becoming a higher and higher priority, but oftentimes we're not really in a centralized fashion knowing what's kind of happening in that area. So let's just move on a little bit. These are just a couple of interesting facts that I will be honest, when I joined the Provider Trust team, I joined the team about 2 years ago. Prior to that, I was a compliance officer in a large post-acute provider, and kind of just made some assumptions about how the OIG's database actually worked. And so I find this interesting now as I have a little bit more opportunity to delve into the information. So we all know that when we go to the OIG website and we type in someone's name, it comes back and it gives us, you know, 1 match, 5 matches, just depends on whatever name I put in. And then it allows me to type in or to verify by putting in a social security number or an MPI number. So I just made the assumption that in the downloadable database that we have, that the social security number or those identifiers would also come with the database. But that's not a factual statement. So when you think about the data as it's coming into your system, if you're doing this manually, it's only going to give you just demographic information, not unique identifiers. So just important to point out, so that the OIG database itself, when you're downloading it, it doesn't have social security numbers, it doesn't have a TIN or an EIN, an MPI, and it doesn't obviously have all of the state exclusions in there. So just a little tidbit that I always find interesting. So let's just dig into the data just a tish before we kind of move on and talk about screening our vendors. So these are some statistics over the past, 8 years of civil money penalties by year related to the exclusions. And you'll notice that the average over these 9 years is about 115,000. Now look at 2014, there was over $9 million of CMPs. So evidently in 2014, the OIG was on a roll and they excluded an awful lot of folks. But you'll see that the numbers are continuing to track in a pretty high range. 8 million in 2016, 5.5 million last year. I apologize, I didn't think to look up the year-to-date number before we started this, but we will definitely have that in a blog in the coming, in January. We'll summarize kind of what we saw in 2018. But the number and the volume we talked about in the previous slide. So you can see again about that 70,000 number for each of the different sites. All right, let's talk a little bit about the guidelines for screening vendors. Oh, before we do that, let's do another poll. Matt is going to give us another poll.
Yep, and this poll question is which department at your company currently manages this process, the screening of vendors? And what we're interested in just learning from y'all kind of where this sits. Often in health systems we see this fall under compliance, but really sort of operations or finance or procurement have really kind of taken a more active role in this process over the past, call it maybe 2 or 3 years, as we've seen this sort of trend spike. So just interested to see kind of where this falls today in our audience and how this is currently being managed. So we'll give it another second or two. It looks like most of y'all have voted, just another minute or two to make sure everybody gets it in. And we'll go out and share the results. So here's kind of, as we would expect, about 58%. This is managed through compliance, so the ongoing process. Maybe as you're doing your employee monitoring, you're also tagging on vendors as well. But kind of, really like I was saying before, we're seeing sort of a mix of different departments that spread this out across different organizations. So about 12% look at procurement, about 2% this falls in legal and risk, 5% this process falls within the finance department, and 23% actually it's some other department within your organization. So really interested to see, and might actually follow up with a few of y'all, just how does this look today? Is there a best practice out there that maybe we don't even know about, how this is being managed? So just curious to hear. If you're so inclined, feel free to put that in the questions bar too. If you answered other, I'd just love to learn from y'all kind of how this is being managed today. And then with that, let's go into guidelines for screening vendors. So obviously today's session is about how to manage vendor enrollment and compliance. We wanted to set a baseline of compliance and regulation in terms of what an exclusion is, and then also what the guidance is from the OIG before we talk specifically about enrollment and how to manage that process as part of your 2019 business planning and operation. So here's what the OIG says. I am not going to read you everything on this slide. We are sending out the slides, as Donna mentioned. That'll come tomorrow as well. So you'll have this to reference, which is the quoted guidance from the OIG. But here's the highlights in a nutshell. The OIG advises, you know what, I just said I wouldn't read to you, and I'm going to go ahead and read you the top line. So here it is. Providers should determine whether or not to screen contractors, subcontractors, and the employees of contractors using the same analysis that they would their own employees. So we kind of take this at face value to say, if you're determining sort of which populations within your employee group makes sense to include in monthly monitoring, that same sort of threshold analysis should be applied to vendors as well. Really what that means, we say that if to be safe, it is worth monitoring your entire population or starting from there as a baseline. Really, when we work with clients and do this for other health systems, both in the acute and post-acute spaces, we recommend everybody starts with everything as a baseline, and then if it makes sense to weed out certain groups as you're going through it based on how you're allocating Medicare, Medicaid funds, certainly look at that. But really, to be safe, we would recommend just let's start with a vendor population that's pretty comprehensive to make sure you don't have any gaps or any holes, just kind of sitting on the fringe. The other piece to this slide, which is really important, again, I'm not going to read you all the text, but this speaks specifically to ownership of vendors. What does that mean? So really, OIG exercises at its discretion any provider owned in part by an excluded person is potentially subject to exclusion as well. A provider owned in part is actually, that's defined as 5% or more. So as you're collecting and managing vendor enrollment in 2019, it's imperative to ask and make sure you're collecting ownership information for any principal of 5% or more of all vendors to make sure that person or entity that's an owning entity is also included in that monthly monitoring as well. The really interesting is we're about to show some case studies, but we are starting to see this become a trend in some of the monitoring that we see. We're now finding cases for our clients of an owner that is hiding behind the corporate veil, if you will, and their entity may not necessarily be excluded, but the person that is the majority owner of that entity might be excluded. That is starting to happen more and more, specifically as the market's getting savvier about monitoring people and vendors for exclusions. The excluded people are finding new ways to actually hide behind those processes and hide behind the holes. This is one of the ways that's starting. The advisements on the screen that you'll get in a takeaway, but really in a nutshell is best practice is to include all vendors in your ongoing monitoring process of exclusions, as well as any owner that owns 5% or more. So to keep on going down that train, we look at vendors, owners, and FDRs, which has been a huge hot topic too. Who is a vendor, right? So a vendor is a legal organization that your health system or health plan conducts business with, right? It's a company, is a legal organization recognized and legally authorized, to conduct business by a Secretary of State. They have an active TIN number, right? If they are billing Medicare, Medicaid in a provider organization, they could potentially have an NPI, right? If they're a billing entity. Right, it's a nutshell. This sounds pretty simplistic, but they must be a registered entity with the state, and they must be authorized to actually bill for services for you to contract with. Before we go into kind of who is an owner and what's an FDR, I believe we have one more poll question, is how often does procurement and compliance meet to discuss cross-departmental strategy or goals? This is a topic in our past webinars. If you've been on some of the ones we've done over the past couple months, we've started to really uncover a theme of how often HR and compliance meet to discuss ongoing people monitoring as it relates to exclusions or licenses or even sanctions. We're interested in exploring that same premise with procurement and compliance. So similarly, how we've explored HR and compliance and the relationship between the two, we're excited to really talk about the relationship between procurement and compliance, just to see, is this something that is happening on just a weekly cadence? Are there monthly meetings between the two? Is it just when special projects come up? Are there no routine meetings? And this strategy largely exists, silos, if you will, or is it some other frequency? And so here's the results you can see on the screen. About 4% of us meet weekly with our either procurement or compliance counterparts. 19% of us meet monthly. 12% of us are just on special projects, and maybe this could be conceived as a special project. 51% have no routine meetings between procurement or compliance. 14% is other. So again, super curious to hear what the other is. Just if you're so inclined, again, write us in the questions thing and just let us know kind of what that other frequency is. We just love to learn. The no routine meetings, here is just a quick takeaway. If you're one of those 15%, you have no routine meetings with procurement or compliance, would suggest what we've seen as best practice is monthly or special projects as it relates to some of the things that we talk about today. Vendor enrollment, vendor compliance, some of those. Would suggest as part of your business planning strategy, if you're sitting in either procurement or compliance and you don't meet regularly with some of your counterparts, now might be a great day to set that meeting. So as a takeaway from today, just would reach across the aisle, if you will, and schedule that first session and maybe share the deck from today and talk about some of these points and just see where you're at would be a suggestion. So we'll round this out with a little bit of detail on owners and FDRs, and then we'll get into the tactical step-by-step process of how do you roll this out and how do you do this effectively in 2019. Who is an owner, right? We did go through this, but really it's any provider owned in part 5% or more by an excluded person is potentially subject to exclusion themselves. We do have several resources that are hyperlinked here on the screen that we'll send to you on essentially why the OIG is concerned with vendor ownership. To quickly summarize why the OIG is concerned, it's because I'll kind of repeat what I said before. This trend is starting to happen more so than ever. We are seeing excluded people hiding behind the corporate veil to continue billing for Medicare and Medicaid services. The offenses are certainly becoming more numeric, but also the dollars associated with these offenses, particularly in a billing relationship, are starting to become higher as well. So we're seeing this trend. The OIG is seeing this trend as well. We stay up to date and going to conferences and just speaking with the OIG on a regular basis. This is coming directly from them. This is happening more, so they're starting to crack down on it. They started in 2018 to really enforce this, and in 2019, this is going to be a priority for them too. And then finally, what's an FDR? Before we get into case studies on all of these, FDR is a first tier downstream and related entities. It's defined by CMS as any party that enters into a written arrangement with a Medicare Advantage organization or Part D plan sponsor to provide administrative services or healthcare related services. This means that your vendors may be considered FDRs given your arrangement with Medicare Advantage, and you may be responsible for monitoring and auditing their compliance with CMS standards as a Medicare Advantage participant. Again, this may not apply to you directly on the call, but if it does, an example of an FDR, there's a list of those kind of on the right-hand side of the screen. Physicians, hospitals, pharmacies, other providers, claims processing vendors, patient management vendors, credentialing companies, CDOs, field marketing organizations, call centers. Those are all current examples of FDRs through the Medicare Advantage program. We just put out a blog post 2 months ago on how to identify an FDR. We will send that out in our recap. So when you get to CEUs, you'll get a link to that blog post. It's been, I'm the marketing guy on the team, so I've noticed just a spike in this topic specifically within the provider world. We just want to make sure you have all the information possible. So how do I identify these? And then once I've identified it, what do I actually do? This is a great thing to get ahead of if you're not there already with the 2019 strategy.
All right, so we're just going to take a quick look at a couple of case studies that we thought were interesting that you might be interested in. The first one relates to a physician and a lab service. And you'll see that through the ALJ process, the OIG's 15-year exclusion was upheld. So I did a little research to understand a little bit more about this particular scenario. So under the Medicare rules for compensation for labs, when they're servicing nursing home patients, they actually are given a reimbursement of, generally speaking, about $1 per mile for technicians to travel to collect specimens from either a nursing home patient or a homebound patient. And specifically, obviously the technician has to be making that travel. So what happened in this particular situation is they billed for all of that reimbursement for the travel expenses, but they actually didn't do the travel. So they were actually batching specimens and air freighting them to their lab, which cost them about $100 per batch. But they billed Medicare for round trip distances between the nursing homes and the labs. And ultimately, they identified that they had over $10 million in claims for the miles where no lab technician actually traveled. So the penalty ultimately was a judgment of $30.5 million because the damages were trebled, if you remember that. We talked about that before, right? So they billed $10 million. The judgment was $30.5 million and a 15-year exclusion for both the lab and the CEO. So that was just an interesting case that we thought we would share with you. Another one in case study number 2 relates to a pharmacist. Now, the pharmacist had been excluded from participating, but they were working through the pharmacy. And so again, this would be a good example of what Dave's talking about, someone hiding behind a different organization. So the OIG settled for $96,000, but again, a different situation where we have a person hiding behind an entity. And the last one I wanted to highlight, this was one that was just shared with us in October, one of the OIG settlements. This is an example of a self-disclosure. So the Detroit Area Agency on Aging self-disclosed that they had contracted with an excluded vendor. And so the settlement that the OIG and the Detroit Area Agency on Aging, they settled for almost $600,000. So when we talk about the seriousness of the penalties of partnering with an excluded vendor, there are real sanctions that come into play. So remember, this is self-disclosed. So this is only 1.5 times the damages as opposed to what would have been 3 times the damages. So again, an opportunity of a case where very recently, October of this year, where there was an OIG settlement.
Thanks, Donna. So let's talk about how to design an effective vendor enrollment process. So we've talked about the why this is relevant, why it's important, kind of what the law says and what the regulation says, and then what's happening today. Where are the what do the case studies show us in the data? Let's talk about how do you actually do this then? What's the step-by-step towards how do you activate this, right? How do you take the data we're sharing today and the regulation and then turn it into a process? So with that, we have 2 more polling questions. Here's one of the last 2. How do you currently manage your FDR requirements, right? So if this is relevant to you, are you not currently collecting data to effectively manage? Are you doing this manually? Are you doing this electronically with reporting capabilities? Are you doing it electronically with no reporting capabilities? Or are you not sure? And certainly if this isn't totally relevant to you, feel free feel free to click the I'm not sure button as well. So again, this is just a current hot topic. We will send out the blog post that we just wrote. You can feel free to Google it if you're curious now. But something that we'll make sure you stay up to date and educated on as we continue our good work in sharing the good word. So here's the results that you're seeing on the screen. 15% are not currently collecting the data to effectively manage. 12% are doing this manually. 22% are doing this electronically with reporting capabilities. 0%, good news, are doing this electronically with no reporting capabilities. And then 51%, I'm not sure, or it may not be relevant depending on your status with Medicare Advantage. So super helpful and super insightful. Thank you guys for staying engaged. So designing an effective process. It's all about data and workflows, and we'll explain two of those pretty clearly and concisely. The data, right, the asset you have to prevent fraud and ensure 100% compliance, and then workflows, the key to efficiency and internal effectiveness. So why data? Here's an example of kind of what we do and what we see. Data, if you go to the next slide, right, what you see on the left is a real exclusion from the Minnesota exclusion list. So this is Yev Gray. Everything you see on the left is what's published at the primary source. The company, Argus Healthcare, his address, the exclusion source is Minnesota. The exclusion date is August 15th of 2017, and he is a podiatrist. That source does not publish a social security number, an NPI, or any license information. Provider trust, kind of what we do behind the scenes and why we say, and we're so adamant about data being, and smarter data being part of your strategy, is we augment primary source exclusions with unique data points so that we can definitively say yes or no, is this the same Yev Gray that's part of your network. So kind of what we do behind the scenes is actually augment Minnesota's record, in this case to include Mr. Gray's social security number, his NPI number, and 7 license numbers across 7 different states. The reason why we would recommend you do something similar, or at least have a process in place to augment your primary source data, is to make sure there's no holes. So the reason why we show this example is because we had a client that Mr. Gray was in their provider network of referring physicians. They were monitoring referring physicians using the NPI and name and address that they had. In this case, they missed Yev Gray because the NPI was not associated with the exclusion at the primary source, right? They came to us, and we actually, because of the work we had done behind the scenes, we were able to catch it instantly on onboarding because we knew that Mr. Gray had this NPI, and we were able to associate the NPI back with the primary source exclusion. We would recommend that you are doing something like this on your own, or at least working with somebody that can help augment your data strategy so that you can eliminate the holes in your various populations. The population that we're going through right now is a referring physician example, but we do the same thing, and we recommend the same thing with your vendor population, with your owner population, with your employee population, any provider networks that you're contracting with. We would recommend you have a holistic, smarter data strategy to help complement what you're trying to do from monitoring. So when we talk about data, what data should you collect? Here's what we would recommend at a minimum during the vendor enrollment process. Legal name of the entity, DBA if it's relevant or applicable, the federal employer ID number, address of company, Secretary of State ID number is certainly helpful when you have it. Super important, information of owners with 5% or more ownership stake. And on those owners, make sure you're collecting the name, the address, date of birth, social security number, and NPI if it's a billing entity. State of incorporation, Dun & Bradstreet number. Does the vendor handle personal identifiable information, PII, or PHI?
Protected health information. Sorry about that little typo on our slide. As I was just looking, I'm like, oh no, we have a typo. We will fix that before we send it out.
Thanks, Donna. And then has the vendor signed a business associate agreement, a BAA? I know this came up specifically in a question, the question of PII versus PHI. I'm not ignoring you. We will get to that kind of at the end, but definitely collecting does your vendor handle PII or PHI is a really relevant thing to collect on the front end. And now, what are the requirements around monitoring them? That I know we had a question about it. We'll get to it at the end, but super relevant to collect on the front end. And then where do I begin, right? I promised you we had 2 poll questions left. Here's the last one. We've had awesome engagement from everyone today, so really appreciate everybody just staying on the call and staying engaged. Who owns the standardization of vendor enrollment requirements at your company? Where does this fall? Does this fall under compliance? Does it fall under procurement? Does it fall under finance operations, legal and risk, or another department that's setting the requirements of vendor enrollment and really activation as well, and getting them up and running with your organization as a partner? We'll give it another minute or two. Again, great engagement. Thank you all for continuing to vote and stay engaged on these questions. Super interested to see kind of how this turns out. So as we close it out, here are the results you see on the screen. 36% is owned in compliance, so not as high as we've typically seen in the past. 24% is owned by procurement. 14% is finance or operations. 13% is legal or risk, and then 13% is other, potentially another department that owns the standardization of vendor enrollment. So again, across the board, we asked a question earlier about how often you're meeting with your counterparts to talk about some of this stuff. If you're one of the departments of compliance or procurement on the phone, and it's another department that owns the standardization of vendor enrollment requirements, maybe time to schedule a meeting and talk about some of this stuff. Share the deck from today and talk about the regulation. So Donna, let's take them through step 1.
All right. So the first step is really just trying to get a sense of, I think, really, who are your vendors? Where's the data live? When we talk to our clients, in my own personal experience, there's data everywhere. It's somewhat inconsistent. We usually talk about messy data, but really understanding, where is this information? Which systems am I able to get it out? Dave's been talking to us about our first tier downstream, partners, and are we going to treat them differently? Is there different information that we need to have? We've talked about the importance of really understanding the ownership information. You might even ask yourself, is there even a place in our database to store or collect that information? How often do we actually validate the data? One of the things that we see oftentimes is, we're trying to hurry to get a vendor partner into our system so that we can start having a service from them. So we may just, skip a few fields and not collect all of the information that we need. So really making sure that you have all the right information, that it's accurate. And then are you looking at it once a year or every other year? How often are you really updating that information? And then, of course, are we doing exclusion monitoring on our vendors during onboarding? What process do you have in place so that before that vendor is paid for the first time or providing a service for you at the first time, have you done a quick exclusion check to make sure that they're in good standings?
Awesome. Step 2 is to streamline and standardize the process. So align internally on core central data points needed for vendor populations, making sure you are doing this in alignment with regulation and alignment with what's going to help your business processes in the long term. Really what we say around here is, what's your baseline for vendor data? If you think about this in the spreadsheet, what's columns A through G that every single vendor needs to have populated at your organization? Super important. It sounds simplistic. It's not, to pull this off. So would recommend that today, take this deck, take that question and start asking internally, what's baseline for vendor data and how is it relevant and how does it impact sort of my day-to-day and our compliance outlook? And then we would recommend running a data integrity scrub for your vendor population to understand the gap analysis. So starting today, this is a fantastic December project. We help clients do this all the time, which is help me understand where my gaps are in our vendor data. Run the spreadsheet of your vendor population and start looking at the gaps. We do it all the time. We'll talk about it a little bit more at the end, but with this process is something we would recommend if you're on this sitting here last week in November, sometime in December before the new year, run a gap analysis of your vendor data and see where you fall. And then Donna, take them through step 3.
You bet. So the last step really is designing your monitoring needs for your organization, right? You have to understand your risk tolerance. You have to understand the types of vendors you have, the technology that you have. We talked about finding all of the data. You certainly have an AP system of some sort that probably has a lot of information. You might have a contract database that has information. You might consider your attending physicians, vendors, even though you're not paying them, they certainly have a relationship with you. That might be in an EMR system. So really understanding your population, understanding where that information is, and then ask yourself, do we have the internal resources that we need to do this? Or are we at a point in time where we need to partner with a vendor? And then most importantly, what is your comfort level, right? What is your level of risk that you're comfortable taking? That will help you decide whether you're going to look at it internally, whether you're going to hire a third party to help you do this more effectively. And as Dave said, really probably maybe step 1 or step 4 in here, bullet-wise, would be partnering with the other departments, right? We've asked you a lot of polling questions where we identify procurement has a role, finance or ops has a role, compliance has a role, really aligning that group and coming up with a cadence to address these things in a go-forward manner, I think would also be another component of kind of that last step here.
Yeah, absolutely, Donna. What I would recommend to everybody on the call is take these 3 slides, step 1, step 2, step 3, and answer those questions for your current process at your current organization. I would be willing to bet that most of us probably couldn't answer all of it alone. So I would recommend finding who the key stakeholders are in your organization, pulling them into the same room and saying, okay, how do we think about this strategically going into 2019? What are the elements that we need to streamline and really make sense of? And tweak, and what are the things that are working well? And let's make sure we continue to do that because we're in compliance and in regulation. If there's anything to take away from today, that's sort of point 1. Take those 3 slides away from today and really run that analysis with your organization. Point 2 to take away from today is doing a data integrity scrub. And here's what we actually mean when we say do a data integrity scrub. Here's a sample of kind of what we give back to clients when we do this. We typically do this for free, which is here's a client that gave us a spreadsheet with 22,000 vendors records. So think about that as rows in Excel from a spreadsheet standpoint. We match it with the IRS. So how many of those records actually matched with the IRS based on TIN? Where's the invalid TIN or a social security number or no TIN? Or a social security number associated with the entity? What is the data quality and completeness score? So as an example, tax ID, 71% have TIN populated, but only 61% of the sample file has the correct TIN, right? So it's actually an incorrect TIN number. And then other identifiers, no NPIs where there should be some, no license numbers or no DUNS, and actually come up with a score. So in this case, with this sample data, we gave that client back a score of 61%. We would strongly recommend doing this at your own organization to find out where you stand as it relates to your vendor data and your population. If you need help on this, we do this all the time. So we'd be happy to kind of walk you through how to actually go about this and maybe even just give you our template of kind of what we do and how it works and how it looks. You're going to get this as part of the slide, so you'll have a baseline, but certainly willing to have a conversation and partner to help get you on the right track.
And I think one thing to really highlight in this area, when you think about monitoring, right, the whole purpose of this conversation is about vendor monitoring and reducing our risk. So if you have bad data, you're not monitoring the right vendor partner. So this really helps you get a jump start to understanding where your risks are. So if you're right now today, perhaps if you were this organization and you were monitoring 22,000 vendors against the OIG list, and half of them you had bad data on, you weren't even monitoring the right person or the right entity, I should say. So you're potentially spending dollars and certainly adding risk to your organization if you don't have good quality vendor data.
There's nothing more frustrating than spending money and resources and time on monitoring bad data when you didn't get it right from the front end. So again, that 3-step process, take it back and let's partner together and make sure you guys have the resources you need to set up enrollment right from the start. If you don't get it right from the start, your monitoring efforts might not actually be, while well-intentioned, they might actually not be effective, right? If you're monitoring bad data in means bad results on an ongoing basis. So that's really the point of today's call. Just a couple of helpful resources. We will include all of these hyperlinks as part of the deck. You'll have it all, just ebooks, resources, downloads, things that you can reference, things that you can bring to that conversation when you reach across the aisle and meet with your counterparts. And that's really kind of that's it for today. The one thing I mentioned on the call is you will get the FDR blog from us as well. We do have two questions. Well, we had several questions come in. We will get to all of them, at least on an individual basis, but two of them we've got time for, and I'll go ahead and run through. So this is from David. David's asking, do you have to run exclusions on companies that do not have access to PHI?
Oh, good question. Yeah, the concept of PHI versus PII versus what they do, really when it comes to monitoring, does not have a bearing. PHI, if they have protected health information, adds responsibilities related to business associate relationships and that sort of thing. But from an exclusion monitoring perspective, it does not make any difference whether they have PHI or PAI. If they're getting monies and you're a healthcare provider that's receiving Medicare or Medicaid funds, then you need to monitor them.
Yeah, thanks, Donna. Last one we have time for today before we close out. Again, we had at least 15 or 20 more questions, which is awesome. So thank you. We will get those answered. The last one we have time for today is we should monitor all vendors across the board, not just our business associates. So to rephrase a little bit, should we monitor everyone or not just the BAAs? Yeah,
so kind of the same answer as the last one. So a business associate is a relationship between parties only that share protected health information. So the answer would be everyone, not just those that have a business associate agreement. So that's why it's important to not just be looking at your contracted vendors, but also any just vendor that you're paying out of like your AP system. So whether or not they have a BAA in place does not dictate the necessity to monitor. You would certainly be monitoring those folks, but many other vendors in addition to those.
Awesome. Thank you, Donna. And then on the last slide, you'll see here's our phone number. If you want to call me or Donna right now,
run.
You certainly can. This is how to reach us. But just in general, in all seriousness, we love talking to people. So if you have a question, just feel free to give us a buzz. We'd be happy to walk you through any of this. Just as a quick reminder, you will get these slides and all of these resources first thing tomorrow morning. So be on the lookout for that email. It'll come from us, but you'll get those tomorrow. So in the interim, if you've got questions, we'll try to reach out to everybody we can today or tomorrow to answer all of your questions that we didn't get time for. Thank you guys so much for joining. Hope everybody had a wonderful holiday last week. We do have, we will also send out, we are in the process of putting together our January, February, March webinar calendar as well. Some really good topics coming on for that. Around just HR compliance and dashboards, and we even have somebody from the FBI coming to help us give some presentations. So a lot of good stuff coming as well. We'll keep you all posted. Enjoy the rest of your week, and if we don't talk to you again, have a great holiday season.
Absolutely. Thanks, and don't forget to share your ideas for webinars for next year too. We'd love to hear from you.